Today I will share some important information regarding seizures. Who is that population who might get seizures in their life? It's not necessary that the only children category will get seizures anytime. Even the adults also can get seizures. So, how it happens and why it happens. So, first we'll see that what is a seizure exactly. So, seizure is an abnormal electrical activity inside the brain. So, whenever a human being is born in this world, from that second, that millisecond, I can say. So, from that millisecond, the brain starts interacting with the environment and it starts processing the information, all the five sensory informations it starts understanding, the processing, coding, and then putting it and storing it into different memory compartments. Every other thing, every other sensory information has memory. So everything goes into the memory. So for any normal brain, when this action starts, the brain is capable of taking this information normally. But when there is some problem for the brain, before the human being was born, the brain is not developed normally before the person was born. And when such human being come into this world, at that time when the brain starts interacting with the environment, the brain cannot process the information the way it should be. And at that moment, whenever there are weak neurons, because of the brain is not developed normally, the neurons are weak in certain areas. And that's why we see the deficits in different areas. Some children may have speech deficit, visual deficit, motor deficit, and many other deficit. So we call it as global deficit. Some children may have very mild to moderate deficit, which are not seen in earlier days or earlier months. And one fine day, the child may show up with some seizure activity, and after that, the parents get to know that there is something wrong. So, for such brains, the brain cannot take the information and process the information normally. So, the weak neurons cannot process the information normally. So, the normal electrical activity doesn't happen. And that those electrical signals which are accumulated and created because of the sensory information, the weak neurons cannot process these electrical signals further and they get accumulated in that affected area in the brain. So as we can say, for an example, if there is a electrical board in the room and if there is some problem with the wiring, what will happen? There will be short circuit. The same way it happens in the brain. So there is a short circuit inside the brain because the electrical signals, the neurons cannot pass it on normally to other neurons and they get accumulated. And there the electrical activity is accumulated and get disturbed, and there is a action which is called as a seizure. So this seizure type of a thing, when happens, the brain, the human brain, decides to shut down to minimize this electrical activity. And when it minimizes, the human brain restarts by itself. So, this is the most complex and unbelievable, marvelous, there is no word for it, the marvelous brain we humans know in this entire universe. This is the most complex machine that decides to shut down and restart by itself. But then this seizure activity may go for some seconds, minutes, hours, and so on. It depends upon the severity of that. So the duration, severity, intensity may differ brain to brain. And for the brains which were actually developed normally, and the human, when takes birth in this world, the normal brain, as I said before, will start interacting with the environment normally. But for these normal brains, they might have some tumor like things develop because of certain conditions. They might have cysts, they might meet with an accident, a road accident, some head injury, or sometimes in rare conditions, we have seen some infections, brain infections, like rabies encephalitis, even autoimmune encephalitis. And these conditions we are mostly seeing after COVID. People who had COVID but did not take any kind of treatment. This population is actually having such very very rare conditions. It's called as autoimmune encephalitis. So for different brains, and actually the brains were born with normal development, everything was going normal, but maybe in childhood or maybe later on, these brains can experience such things. And for such brains, the seizures might happen. And what I have seen in past my more than 15 years of research with these neurological conditions, the persons having traumatic brain injury, that is a sudden hit to the brain. So it is like if we just put things in like the bottle and it is filled of things and suddenly it falls and gets a very hard hit on the ground or somewhere. It all shuffles, and the same way it happens inside the brain. And for such brains, the seizure pattern will be very different. And mostly I have seen that these people are unconscious for long time, for longer time, and they need hospitalizations because all of this sudden shuffle inside the brain. I haven't seen so far people having stroke or Parkinson, Alzheimer, dementia having seizures anytime. Only the stroke population, sometimes they fall from somewhere when they have the stroke, and there might be a combination of head injury and stroke. So, these are the different conditions for the brains, and where we see that the injury that happens, as I said, that for developmental disorders, there might be some control over the epileptic actions, the seizure patterns. These people are on the medication. So, for most of them, seizures are under control. But of course, as I said in my previous video, that the brain will have loss of information with every other seizure. And if this loss of information is not filled on time, the brain will go backward in learning. So it's very important for the brain to again regain that information. So for the developmental disorder brains I have seen, that whenever we start the Brain Next rehabilitation program, these brains are learning for the first time in their lifetime the new information. So, their response to that having new information for the developmental disorder brain, having seizures, is very different. But the uh, the improvement what we see is very fast. For the children population, I have seen that within 1.5 months, the brains improve more than 30% from their basic conditions. And that I have seen uh, the 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 response to the accumulating new information, the brain which is learning for the first time, and that is their learning. And for the other brains who have seizures because of certain conditions, that time I have seen that that's a new learning for the brain. But the brains who were normal before, the learning was already done, and for these brains it's a relearning process. And the brain which was normal before, the brain which was developed normally, that brain knows what is the normal condition of the brain. And amazingly, I have seen that these brains acquire information very, very fast because they know what is normal. So they go faster to that condition. Though these brains have suffered a lot, very, very severe conditions with post traumatic conditions or maybe post operative brains, very, very severe conditions before, had been in coma condition for more than 1 month, and all of these features. But when we started brain rehabilitation for these brains which were normal before, it was amazing to see that the brain wanted to go to that normal stage as soon as possible. So we have seen very positive development even in these brains. Within just 1.5 months or 2 months, the brains recovered more than 35%. So this is how the seizures differ in all of these brain conditions and their responses to injury and brain rehabilitation.